Welcome back. Let's talk about hypertension a little bit more in here. Some of the numbers in terms of public health details, and then also some novel ways to treat hypertension or some other findings related to pathogenesis of hypertension. All right. What is striking is 1/3 of the population suffers from hypertension. Okay. And these are some additional numbers we have gone over before. So I can take you to the next one. Here you learn that older you are, more susceptible to this disease. Women catch up at about 64 years of age. And then in fact, as you see in the older group, you see more females suffer from hypertension than male. Okay, and another striking detail is African American women have the highest incidence of hypertension. Here we will look at global numbers. 25% globally suffer from hypertension. And what is striking is patients that show up for non-cardiac surgeries, 1/3 of them have hypertension. So that is the normal number of incidents, 1/3. So that matches that. But take a look here, patients that come for coronary bypass surgery, 2/3 of the patients having coronary bypass are hypertensive. What does that tell us? Hypertension leads to other types of heart diseases. Okay. Now, other findings, these are some latest findings about hypertension. The focus lately has been to do with inflammation, oxidative stress, cell death due to inflammation, and that has to do with baroreceptor reflex dysregulation. What does baroreceptor reflex do? Baroreceptors detect changes in blood pressure and send signals to the vasomotor center to turn off sympathetic activation and turn on parasympathetic activation. Both of these changes occur simultaneously, but if this reflex is not turned on, then the regulation of blood pressure is not there, right? And now another new bit of information is there is additional production of angiotensin 2. So originally we have learned that liver is the one that makes this protein angiotensinogen, which gets converted to angiotensin 1 and ultimately angiotensin 2 by angiotensin converting enzyme. But now we know that angiotensin 2 can be made by some other tissues like adipose tissue, blood vessels, heart, adrenal glands, and brain. So the function of angiotensin 2, as you know, is vasoconstriction. Vasoconstriction increased resistance, peripheral resistance, that would increase blood pressure. And another new bit of information is non-ACE enzymes. Non-ACE enzymes are non-angiotensin converting enzymes. These are mainly proteases. They also act on angiotensin 1 and convert it to angiotensin 2. So it's like new ideas here, new compounds being reported also play a part or help explain the pathogenesis of hypertension a bit more. Okay. Yet another one is disruption of ANP release. Atrial natriuretic peptide is released by the heart itself. Atrial muscle fiber is the source, and then the myocardium is where it is released. ANP and brain natriuretic peptide, which is again made by the heart. ANP, BNP, they are the ones that reduce blood pressure. Whenever there is high blood pressure is when they're released, to reduce blood pressure. However, if their actions are disrupted or the receptors where they bind to are defective, that could be the cause of hypertension. So these are some additional new details for us to add to the traditional details we have already discussed. Okay. And now, new approaches to treat hypertension is where you will learn some more new details. Natriuretic peptide, ANP, BNP, is actually degraded in the body by an enzyme, neprilysin. Now, another fact that you may want to know is endothelin converting enzyme is what is needed to make endothelin 1. Endothelin 1 is a vasoconstrictor. Endothelin 1 being a vasoconstrictor would raise blood pressure. A natriuretic peptide is degraded by neprilysin. So what if we have an inhibitor of neprilysin? That means we have the effect of natriuretic peptide over a long period of time. So that's one approach. And then inhibitor of endothelin converting enzyme. How does that help? When you inhibit endothelin converting enzyme, you're not making endothelin 1, and that is how you can help treat hypertension. Okay, so that's overall goal is to cause vasodilation. Without endothelin 1, you would have vasodilation. With natriuretic peptide, you would have vasodilation. So those are the desired effects that would help treat hypertension. Here is a list of injuries or damage that hypertension is responsible for. Vasculopathy, that is blood vessel abnormalities. Okay, you're talking about endothelial dysfunction. Endothelial dysfunction, think about it. If there is high blood pressure, the high pressure would damage the innermost lining of the blood vessel. So that is going to be damaged. Remodeling is new muscle fibers or connective tissue fibers are added in this site of injury. That is because of inflammation in the inflammatory agents triggering remodeling function. Then atherosclerosis, because of the rupture to the endothelial lining, that's where the lipids can make their way into the vessel, and then the oxidation of these lipids can lead to a release of these products which cause inflammation. Okay, oxidative stress and reactive oxygen species and other agents that cause injury and inflammation leads to inflammatory agents. So basically atherosclerosis is the buildup of plaque within the vessel would narrow the lumen size, therefore less blood moving through to the adjacent sites, and so ischemia, hypoxia, etc. That you are familiar with. Arteriosclerotic stenosis. What that is arteriosclerosis is different from atherosclerosis. How is it different? Arteriosclerosis is where the blood vessel is stiffer because you have calcium buildup in the vessel wall or protein structures being added and replacing the normal, healthy, elastic nature of the blood vessel wall. Why? Because high blood pressure pushes some of these structures into the vessel wall, and so the proteins are added to the vessel wall, and therefore there is stiffening of the vessel wall, and then stenosis is the narrowing of the lumen simply because of the increased thickness of the vessel wall. Another complication with hypertension is aneurysm. Aneurysm is the bulging of the blood vessel. Okay, we will discuss aneurysm elsewhere, but aorta happens to be one of the common sites for aneurysm, and so that is possible with hypertension. Please note that the blood pressure is greatest in the aorta, and therefore, so it's more common in the aorta. Okay, other other implications due to hypertension are cerebrovascular damage, that is pretty much stroke. Okay, encephalopathy, stroke, intracerebral hemorrhage, blood vessel damage within the brain, leading to hemorrhage and then stroke. Infarction is again the local tissue death because of poor blood supply, and vascular dementia because of the loss of blood supply, because of the loss of tissue. Retinopathy, same idea, high blood pressure, damage to capillaries, and then the retina is affected by the poor blood supply. A heart disease, we already looked at how heart disease could be common among hypertensive patients. Left ventricular hypertrophy, because the ventricles have to overcome this high blood pressure, and the increased workload would cause hypertrophy of the left ventricle, and then the filling issues, and then heart disease. Atrial fibrillation is another common condition related to hypertension. Coronary microangiopathy, these are small blood vessels that are diseased. These are coronary injuries related to hypertension. Coronary heart disease, myocardial infarction, heart failure, all of these can be related to hypertension. Nephropathy is renal disease. Okay, all kinds of disease, albuminuria, meaning the damage to the blood vessel. Albumin is now in the filtrate instead of being back in the blood. Protein in urine, and then chronic renal insufficiency and renal failure. So these are all pretty serious conditions, ultimately leading to death because of these other conditions due to hypertension. All right, so this is where we stop. Thank you.